So testosterone, I remember when I first saw it in a case with a patient. I was in med school. I was on a rotation. I saw this woman's testosterone was so high relative to the normal, and it was within range, but it was still higher than I expected. And I was like, "What is this?" you know, and I was like, "Something's wrong," and I was worried. And this is the first time I ever met a patient who a woman who had had testosterone replacement therapy in the perimenopausal state, and I did not recognize labs like that. I'd never seen them clinically, and it's not something that's in the books. It was never something really taught. This is again testosterone replacement therapy in women, not really well documented, not really well researched, not really well illuminated in the field of medicine. So it was one of those things that startled me because I had no framework of understanding. And even to this day, when I practice medicine and I treat someone with testosterone, in the back of my mind, I always know there's going to be another doctor who's going to see these labs and not understand. Part of the job when you do hormone replacement therapy with patients is to let them know, there's a chance if you go to another doctor and they see your labs, they're not going to understand this. And it's our jobs to always explain to you why and why what we're doing is healthy. And in a way, my job is also to do my best to make sure you know how to educate your other care providers that this is okay what you're doing, because a lot of the times they're not up on this, they're not keeping up with it, and it can be confusing when you go to another doctor and they say this is crazy, what is this, what's going on here, and they don't understand. It can be very confusing to you as a patient. So patient education in testosterone replacement therapy is everything.